A 56-year-old man with a history of stable angina and erectile dysfunction presents for follow-up. His current medications include metoprolol, atorvastatin, and sublingual nitroglycerin as needed for chest pain. He asks about starting sildenafil. 1 hour after taking his first dose at home, he develops dizziness, flushing, and syncopal episode. Which of the following best explains the mechanism responsible for this patient's symptoms? All right, so it's clear that whatever he has is as a result of a side effect of a medication, particularly the one he just started. All right, so you've seen dizziness, flushing, and a syncopal episode. All right, so if you see flushing, that means there is peripheral vasodilation. Okay, and if there's that much vasodilation, you're going to take blood away from the head, which will cause the dizziness and the syncopal episode, that's fainting, right? All right, so now you only have to know the mechanism of action of sildenafil, and sildenafil is basically Viagra. So the MOA is inhibition of phosphodiesterase 5, leading to increased cyclic GMP and excessive vasodilation. All right, so basically you have phosphodiesterase 5, right? Usually it causes the breakdown of cyclic GMP. All right, and cyclic GMP is responsible for vasodilation. So vasodilation. Okay, so by inhibiting phosphodiesterase 5, you're going to increase the amount of cyclic GMP, which means you're going to increase vasodilation. So vasodilation. Now, the issue is you've mixed it with other things that cause vasodilation. Right? For instance, nitroglycerin. That causes vasodilation, increases nitric oxide, which will in turn increase cyclic GMP. Okay? Metoprolol is a beta blocker, is a cardioselective beta blocker. But let's just look at the other options, right? Competitive inhibition of beta-1 adrenergic receptors causing decreased cardiac output, right? So that's mostly, it is the cardioselective beta blockers, right? So we're talking about something like metoprolol, which the patient is already on, and stuff like atenolol, and bisoprolol, stuff like that. Then option C, blockage of L-type calcium channels in vascular smooth muscle. This is not correct, and it has nothing to do with the whole cyclic GMP nitric oxide cycle, right? And we're talking about stuff like amlodipine here, so amlodipine, all right, and verapamil. Okay, so option D, inhibition of angiotensin converting enzyme, resulting in decreased angiotensin 2. So we're talking about ACE inhibitors here. So ACE inhibitors. Okay, so again, sildenafil, basically Viagra, causes massive vasodilation by stopping phosphodiesterase 5, which will increase cyclic GMP. Right. So this was the drug was initially meant to treat like angina and hypertension, but then they saw like some significant side effects that, let's say, people actually wanted, so they marketed it as Viagra, right? So yeah, see you in the next one.